Konnichiwa, minasan. Ohai gozaimasu. So for today, we will talk about the basic sa Kaigo Ego. First, we have what is the appropriate description about normalization. When we say normalization is continuing a normal life of a user and maintaining a usual way of living. And next is we have appropriate description of quality of life of a user. So this just means the quality of a person and its mental well-being and also his health. Next we have what's the appropriate description about confidentiality of a user. So as a care worker must not spread every single information of a user in a social media context, etc. It's damages. And next is we have what is the appropriate description of user-centric in daily living. Even if a user, a person with a need of nursing care, it is also the user, him herself, who take care the lead of living. Like igo rata mag-guide or mag-assist. And next is we have appropriate description about interprofessional collaboration. This is the term of other professionals in the facility other than the care workers work together as a team to provide the user a center of care. And next we have appropriate description of care services in Japan. This is term care services can be provided in the facility or in the residence of the user. And next we have what is the appropriate description of infectious disease. When we say infectious disease, yung makakahawang disease is a person with low immunity is more vulnerable for this infectious. So yung madaling mahawa is yung mga low immunity, like yung mga user natin. And next is what is the appropriate description of body mechanics. We say body mechanics is when we use the principle of lever. And next is we have what is the appropriate description to provide the spread of infection. Number one, first we have is wash your hands even after wearing gloves, after diaper change, and also one wash. And next is what is the appropriate description of hand washing. This is the interlands of finger and wash the area between the fingers and both hands. Dito lang hands natin. Dito. And next is we have what is the appropriate description about accident prevention and also safety measures. Most of elderly is weak na sila. Listen to him or her carefully for us to assist them carefully and to provide their needs. And next is we have what is the appropriate description about love, belonging needs. These needs to be involved with others, for them to make them feel that they are not alone. And next is we have what happens if diabetes isn't left untreated and progresses. So when we say diabetes progresses, this can damage our nerve, not only nerve but kidneys and also retina in our eyes. So it can affect our sights. And next is what is the appropriate description about fractures. This is the common incidence in the elderly because of the loss of calcium in their bones, and fracture in common in elderly is you called a femoral neck. Femoral neck area is often found in elderly people. So, ito yung weak sa kanila. Kaya, dito siya nagkukos ng fracture. And next is we have, what is an example of instrumental activities of daily living? This is called IADL. One of the example of this is doing laundry. And next is what is the appropriate description about dementia? Dementia is common in elderly people, and this is what we call Alzheimer's dementia. Alzheimer's dementia is associated with forgetfulness, yun na makakalimutin, and also disorientation, yung pabago-bago ng lalo nakakalimutan, ganun. And next is we have, what is the key point of remembering when cleaning? Users can be forgotten. Makakalimutin sila, kaya dapat when we cleaning in their rooms, dapat aware sila. For example, they arrange the things in the room together with the user. Sojishimasho. And next is we have what is the appropriate description of a verbal communication? Example of this is letters and also characters. It can be provided in pictures, like something like that. And next is what is the appropriate description of record keeping? Keep records while your memory is fresh and clear. Kiryoko. Hi. And next is we have how can you avoid a knee buckling when walking or standing of the user? So, care worker must provide support on the affected side, and so that the knee will not buckles. It's because it is an affected side, so hindi na makokontrol yun, kaya yun yung doon tayo magsusupport para kapag tatayo sila or upo, hindi sila maggaganon. Minasan.